Hi, my name is Mohamedin Diamadon, a nursing student from Notre Dame of Tacurong College of Nursing. So today I will be performing on the assessment of the breast. The procedure for the assessment: assess the client's and physical and psychological aspect before and during examination. Rationale: allows healthcare provider to gather complete data about the client's health status. Hello sir, good morning ma'am. Next is review the body areas to be examined. Helps examiner or the healthcare provider identify which part of the body is to be examined systematically. Next is for the planning. Make a physical and environmental preparation before examination. So, rationale: proper preparation of the environment, client, and equipment ensure smooth physical and examination with few interruptions, and to determine and prepare materials, equipment needed. Next is for the implementation. Identify and explain procedure to the client. Rationale: to ensure that procedure is done to the right patients and to reduce anxiety and to ensure patients' cooperation. Good morning, ma'am. Kamusta po kayo?
Yun lang.
Okay po. Ako nga po pala si Mohamedin, ang nurse mo sa araw ngayon. Ma'am, i-assess po natin ang inyong dibdib or ng inyong breast. Okay lang po ba? Thank you. Next is provide privacy. This is to provide a secure environment for the patients. Properly position the client. Rationale: proper positioning ensure easy access to the body parts to be assessed and client feels comfortable. Next is take the health history of the client. Rationale: to assess and to determine, identify abnormal findings in the body system. Ma'am, tanong ko lang po, nagkaroon na po ba kayo ng sakit? Dati po ba nagkaroon na po kayo ng sakit sa dibdib? Wala po. Okay, thank you. Next is for the inspection. Observe breast for the following. For the size and symmetry, it should be relatively equal and slight variation. For the shape, it should be round and procedulous. For the color, pink share with age and pregnancy. And for the skin surface, it should be smooth. Next is observe areola and the nipple for the following. For the size, relatively the same, slight variation. For the shape, round, oval, and inverted. And for the color, pink to dark brown. For the discharges, non-clear yellow and 2 days after the children. And for the texture, a small Montgomery and tubercles presence. Now let's proceed to the palpation. Position the clients in supine position. Rationale: in the supine position, the breast flattened evenly against the chest wall, facilitating palpation. For the temperature, it should be warm and for the elasticity, it should be elastic. For the tenderness, non-tender or slightly tender before menses. And for the masses, consistency and location according to quadrants. So the bilateral firm, inflammatory transverse the ridge of base of the breast. Using a circular motion, palpate the breast. For the palpate of the lymph nodes, non-palpate less than 1 centimeter. And then palpate the nipple gently for discharges. Non-clear yellow 2 days after childbirth. Ma'am, ipapalpate po natin ang inyong nipple, ma'am, ha? And then, teach the client to the technique of best self-examination or the BSE. This is to look for the charges or problems in the breast issue. And for the evaluation, make findings of the health assessment and physical examination done to the client. And these are the important data to convey in the physician to aid the diagnosis of the patients. For the documentations, record, document, and report any patient's findings found in the assessment of the appropriate personnel. And this is to provide accurate data in the care of client.